Welcome to the On Record podcast. This is a podcast where we speak with subject matter experts who are using video in innovative ways to achieve their organization's objectives. We're here today live at IMSH 2026 in San Antonio, and our guest today is Dr. Marie Lindley. Dr. Lindley is the Associate Dean for Strategic Initiatives and Innovation and Clinical Associate Professor. Welcome to the podcast.
Thank you very much.
Before we get started, can you tell us a little bit about yourself?
So I've been with the university for about 10 years. I've been in higher education for about 15. Simulation has become my passion, but all things higher education in the field of nursing is really speaks to my heart as well. So prior to that, I was in the clinical environment and worked in leadership and direct patient care prior to that.
This is Carmen. I have the honor of working with Dr. Lindley and her team, and she brings 10 years experience to the table, which is quite significant. Dr. Lindley, what are some examples of trends you've seen change over time from when you first started in this role until now?
Well, actually, it was probably about 25 years ago when I saw my first high-fidelity simulation mannequin and wrote my first grant. For that, it was not funded, but but have seen simulation evolve over time from both the clinical practice side through higher education. What has transpired the most, I think, is the investment that technology companies have made to truly increase that level of fidelity over time.
Realism is critical, and it leads to better outcomes for your students and patients eventually.
Can you tell us a little bit, share with our audience the value that you've seen video play in achieving student outcomes?
Video, in multiple ways, allows us to help our students process information, but even more importantly for us, it helps our faculty and our simulation staff be able to both facilitate effectively and provide feedback to the students so that they can take those lessons learned into their future practice.
Can you give us a couple of examples of how you use video?
Currently, we use our video system during our simulations, and we have our students observe the simulations. They take turns going in and being in the role of the nurse or the provider, and the other group is observing, and then they have an opportunity to review highlights of that. Mm-hmm. For better or worse, they get to review those highlights, and students have grown to enjoy that piece of it. At first, they're hesitant about being recorded or being on video, but then when they get to see their stellar moments, it boosts their confidence. And when they get to see areas where they may have been able to make better choices, they're able to still use that as a positive learning experience. But if faculty, staff, or students are reluctant to be recorded and then have it played back, one of the things that we remind our students of is that once you hit the clinical area, you will always be being viewed. There will be family members at the bedside. There will be another provider there. There'll be a fellow nurse in the room or the charge nurse. And all of those things can be rather intimidating. Now, with more technology going into the hospitals with virtual nursing and stuff like that, there's more video recording. So there's a very good chance you're going to be under some kind of video or surveillance when you get into clinical practice anyway. So let's use it. Yeah. Let's just make that as part of our realism in our simulation.
Okay. That's a very interesting perspective. Yeah, I've never thought of it that
way. I like that. Psychological safety is so important, but also the ability to see yourself on film, to take ownership and accountability for ways and areas you can improve. I know your team uses it for debrief, like you mentioned, so very critical as well to have that reflection time.
Yeah, one of the things that we commonly hear with video playback, particularly from a student's perspective, is this aha moment when the student will see themselves because they thought, well, gee, I did this or I did that. And then when they see themselves like, oh, maybe I didn't do that in the right way. Have you had similar experiences?
So what students often will recognize is in their communication, because so much of communication is nonverbal, they really get to see, especially our more novice students, get to see how task-oriented they are and how they're not necessarily communicating that warmth that they want to because they're so task focused. But then when they see themselves, they're like, I could have done that, or I could have smiled more, or I could have done that soft touch a little bit better. So it really is a great way to just increase awareness of those things.
So you've been very instrumental in putting together an AV system for your organization. What kind of challenges did you experience in rolling a system like that out?
Well, I think that part of any time an organization is going to be implementing a technology across their curriculum, there's a couple of key factors that they need to take into play, particularly as we are in our current state and moving forward. We are in a fortunate position of seeing increased enrollments, and enrollment trends at the moment are up across the country. In speaking with other colleagues in this venue, that is across the country. It puts a strain on clinical placements, which drives the increased need for simulation. So if we're using video systems and we're using additional technology to help support those student learners, it's vital that those technologies support the faculty just as much, because the cognitive load on the faculty side has also increased exponentially. And so for every click that a faculty member has to remember to do in a software, or an extra button or an extra login, or every single step of that can become a barrier for faculty adoption. Because if there's a perception that it's difficult, it makes that rollout more challenging. So if there are truly user-friendly, and I know that's kind of a buzz or tag word, but genuinely user-friendly products out there, that is what is going to dramatically increase the adoption across the programs. And people come to love it as opposed to, okay, I have to do this because I have to do this.
A very, I would say, advantageous position. Your organization very much backs expansion and making sure you have resources to be able to have simulation happen on a larger scale and increasing those resources. What advice would you give if someone was looking for ways to find and seek grants, or what creative ways would you give other simulation centers or locations to find funding and to be creative to get those same resources from their own team?
I think that we have been successful in doing that in partnering with our university's development office, as well as working with private foundations as well as state grants. If you don't apply, you can never get, right?
Yes, that's true.
So
if someone's interested in reaching out to you to pick your brain more about how you're able to achieve the success that you brought Baylor University and your team, how would you like them to contact you?
they can reach out to me on LinkedIn. It's probably
Excellent.
the easiest way. Thank you.
All right. Well, thank you very much. This has been
you.
a very informative conversation.
On Record is a podcast presented by Intelligent Video Solutions, hosted by Mike Anzalone and Andy Simmons, and produced by Kyle Shellstad. Find us online at ipivs.com/onrecord and on social media at Intelligent Video Solutions.